Just a brief logistical update. My name is Joe Novotny. I'm the Director of International Research Support Operations. I'm going to hand it over to our speakers in a moment. As this is a webinar, we are taking questions via the Q&A box at the bottom of your screen. When you submit a question, please be as clear as possible and submit your name in that. And we will try to get that towards the end of today's webinar session. Thank you for your patience today. We look forward to a valuable presentation. I'm going to hand it over now to our Assistant Vice Chancellor of Research, Winona Ward. Thank you.
Thank you, Joe. Hello, everyone, and welcome. As Joe said, I'm Winona Ward. I'm in the UCSF Office of Research. I also serve as a member of the UCSF Global Programs Board of Directors. The UCSF Global Programs for Research and Training that you'll hear about today is a wholly owned and controlled affiliate entity of the University of California, which is registered as a non-governmental organization in foreign countries. It is governed by a board of directors comprised of UCSF faculty and staff, along with local national leaders in each country, and administered by the UCSF International Research Support Operations Office, led by Joe Novotny. The establishment of the Global Programs NGO allows University of California, San Francisco researchers to directly guide and implement their international research and training activities. Grants awarded to and managed by UCSF with specific in-country implementation processes are supported by local Global Programs offices. Global Programs operates under policies that are aligned with UCSF policies, but modified as needed to ensure compliance with local laws and regulations. Launching Global Programs has enabled our researchers to think and act locally through our local NGO entities and country. As our campus explores opportunities to increase equity in global health partnerships, new collaborations developed through our Global Programs offices offer opportunities to respond to the priorities, needs, and interests of local host country partners. As an example of the benefits of global programs, today you will hear from Dr. Koki Kinagwi, Country Director for Global Programs Kenya's country, about potential collaboration opportunities in Kenya based on the research priorities of the government, health sector, and local academic institutions. Our global program staff across sub-Saharan Africa offer UCSF researchers an opportunity to identify and develop new partnerships with local collaborators. Today's webinar will hopefully be the first of many in which we connect through our local global programs offices and their teams to identify new research and training collaboration opportunities. Next slide, please, Koki. Next slide. Thank you. So briefly, the session objectives for today are to describe Global Programs Kenya support model at UCSF and the active UCSF projects, to highlight ongoing UCSF health informatics work in Africa supported through Global Programs Kenya, to present collaboration opportunities with partner entities in Kenya across government, academia, and civil society, and to discuss potential areas of interest of UCSF faculty for growth and collaboration in Kenya. It is now my pleasure to introduce Dr. Koki Kinagwi, who serves as the Country Director for Global Programs for Research and Training in Kenya, and has the overall responsibility for strategic leadership to achieve the organizational vision, mission, and objectives. She is a medical doctor and public health specialist with over 2 decades experience in healthcare. She previously worked at AMREF Health Africa between 2011 and 2017 in various roles, including Chief of Party for both the USAID funded AFIA, TIMISA, and AFIA Plus Imarisha programs. She also previously worked as the Director of African Network for Health Knowledge Management and Communication. Koki is a member of the Women on Boards Network Kenya, Institute of Directors Kenya, as well as the Kenya Institute of Management. She was also one of the Business Daily Top 40 Under 40 Women in Kenya in 2014. Koki?
Thank you, Winona, for the introduction, and good morning, everyone. and welcome once again to this webinar. And so I'll get started. So let's talk about global programs. So as mentioned, we are affiliated entities registered in foreign countries that are wholly owned and controlled by UCSF. And we are registered in each country as an NGO governed by a board of directors, and the majority of the board is represented by UCSF faculty and staff. And the main objective of global programs as an institution is to assist in the creation of sustainable healthcare, education, and infrastructure, leading to the measurable enhancement of the quality of life among people affected by HIV/AIDS and other illnesses or disabilities. So this picture here just gives an idea of all the country offices that we have. We have 7 in total. We have 6 in Africa, with Kenya being the largest office. We have 1 in Tanzania, Uganda, Mozambique, Namibia, and South Africa. And we also have an office in Laos in Asia. So that is just an introduction of who we are and what we do. And when you look at the setup at UCSF, this is how we fit in. We have, of course, the UCSF Chancellor, and we have the EVCP, who the UCSF Global Programs Board of Directors report to. And we also have the International Research Support Operations Office, where the Global Programs Management Team sits. And these oversee then all the different country programs in the 7 places. And then we have the investigators and the research teams as well. So this is basically how we interact together in form of the structure and how we fit in within UCSF. So global programs, as mentioned, was really established to facilitate the expanded presence and operations for UCSF researchers and affiliates in Kenya, and to really offer support for the different projects that UCSF had been doing and was doing in this country. So we officially began operations in September 2015, and we have 2 offices in Kenya, one in Nairobi, which is the capital city of Kenya, and another one in Kisumu, which is in the western part of the country. And through these 2 offices, we are able to provide support for all of UCSF's projects and studies that are taking place in this country. So what support do we exactly provide? So we have an array of things that we do, starting with just around financial, being able to open and manage local bank accounts. We pay the staff and vendors in the local currency. We distribute and manage the petty cash for program activities. Regarding hiring and basically the HR part of it, we act as the local employer of record. We ensure that, taxes are submitted and to the government as required. So, withholding tax, reporting all the statutory deductions, we make sure that that is done and that there is compliance with the local labor laws. Under procurement, we are able to identify and communicate with potential vendors. We ensure affordable procurement and speedy delivery of whatever is needed for the projects. And we sign contracts that are governed under foreign jurisdiction. So we are the ones who are able to get into contracts with the vendors, make sure that they have supplied what is needed, and that, at the end of the day, the projects are able to implement as planned. Regarding logistics, we coordinate local travel for the staff and partners, and we're able to host meetings, trainings, and any other events that are related to the various project activities. We also assist with partner support because UCSF has various other partners in country. So as needed, we are able to assist local partners with award management. And also we participate in national stakeholder strategy development. We are able to enhance UCSF's visibility within the country, participating in various technical working groups and so on. So we are able to make sure that, as an organization and as the university, we are able to contribute to the various things happening in the health sector in this country. So this just gives you an idea of the operations team. We do have the technical team, but I've just focused on the team. This is the team at the center that supports all the other teams that are in place implementing the projects. So we really have, there's operations team, we have an IT team, we have HR, we have transport and logistics, we have procurement, and we have finance. And these are split between the two offices. And as I mentioned, the office in Nairobi, which is the head office, and the office in Kisumu. So this is a lean team that is able to grow as needed to meet the requirements on the ground. So currently, we provide logistical, financial, operational, and administrative support to over 30 UCSF research projects. Some of these being, large multi-million-dollar awards for global strategic information under IGHS, which are focused on improving epidemiologic surveillance for HIV. We also have studies such as the SURGE study, which is led by the HIV, Infectious Diseases and Global Medicine Division. And this is being done in partnership with KEMRI, which is the Kenya Medical Research Institute. And it's a clinical trial, which is looking at prevention and treatment strategies to reduce HIV incidence and HIV-associated mortality. We also have other studies that are looking at, food security and related HIV outcomes, maternal and child health care, tobacco cessation, mental health issues, COVID-19 infection, among others. So it all depends on really what are the areas of interest, what research are there, what research is being done, and we're able to support them all as needed. This just gives a snapshot by department of the number of projects. So the largest number of projects is from the IGHS group. We have 39. We have Bixby with 4 projects. We have Department of Medicine that has 9. We have the Departments of Psychiatry with 2, Department of Epidemiology and Biostatistics 2, School of Nursing 2, Department of Pediatrics 2, and Proctor Foundation 1. So under these, then we have different projects. And so you can see there's quite a wide array. I know initially at the beginning, the focus was really heavy towards HIV, but with time and over the years, it's been able to expand to various areas of interest. So all these are projects that we are supporting and helping the team make sure that they achieve their objectives. So now I'd like to introduce David Mugume. He is the Deputy Director of the Global Health Informatics Hub. And what this hub does, it supports UCSF's global health informatics needs. So we thought it would be good for you to have a snapshot of some of the work that they're doing. The headquarters of the hub is in Nairobi, and it's supporting various projects. So over to you, David, to take us through the informatics hub. Welcome.
Thank you very much, Koki, and good evening, good morning, good afternoon, everyone. So just to dive right in, the informatics hub, whose regional headquarters are in Nairobi, we are more than about 42 informaticians with different skill sets ranging from machine learning to building EMRs, that's electronic medical record system, to visualizations, policy and governance, and all of these are working together with the local the local ministries, local partners, and funders, etc., to deliver the projects that we're working on in these countries. Next slide. So this slide just shows some of the countries around the globe that we are helping with informatics needs. So the Eastern Central Africa, Southern Africa, we have North Africa, Egypt, Morocco, Middle East, we have Laos, we have Thailand, and then in the Caribbean as well, some tiny countries you cannot see over here, Trinidad, Jamaica, and Paraguay. Next slide. So just to talk about some of the projects that we've worked on. So this machine learning project, which was helping to predict one-year mortality rates for HIV clients. So this happened in Kenya. Basically what we had was 2.8 million records. So each record, of course, being an individual client, we filtered that down to 2.4 million, taking out clients who are below 15 years, and then took 900,000 records of those to build a model, it's a machine learning model, train that model, and the results of that model, we applied them onto 1.5 million records to just look at, in the future, 1 year from now, what will be the mortality status of these clients, to try and predict that. So this, the results for this are not yet out, but definitely this would help in predicting and helping fight epidemics around the region. Next slide. Yeah, so we're also working on case-based surveillance in Kenya. So basically consolidating different data sets. Kenya has quite a lot of different data sets and systems. So consolidating those into one data system, and then using that to inform the HIV epidemic. We're also working on, we also use actually e-learning materials using a platform called Moodle. And these materials are being used by multiple stakeholders to learn and get information about how to handle the epidemic. We also have quite a number of work around from the Technical Assistance Platform TAP, also in Kenya. So just to highlight a few, one of them is helping Kenya upgrade the Kenya EMR, which is based on OpenMRS, upgrading that to version 3.x. So version 3.x of OpenMRS is quite elaborate in terms of interfaces and usability. And we have work that we've done, and we're using that to transfer that to Kenya EMR. Next is also patient identity management. We've also done work through the Kenya office around the region, such as Namibia, recently Uganda. So the same we're trying to assist Kenya in patient identity management. So that's the master patient index. We're also working to support tooling and providing capacity building to develop national data, health data dictionary. Next slide. So Kenya recently started pretty much around Kenya, and basically recently is trying to figure out HIV infections that were acquired in the last 12 months. And that helps to identify which hotspots are having some lapses in HIV prevention programs. So initially in Kenya, expanded to other countries, Namibia, with the same assistance of the hub personnel in Kenya. Also Uganda assisted with recently Namibia, and more recently Tanzania. Next slide. So also through the Kenya office, we have server personnel or server managers. Actually, entirely all our server personnel are based in the Kenya office. They help us, actually pretty much all the projects that we have around the globe, they help in managing the infrastructure, scaling, setting up the servers, ensure that the security is right as per the UCSF IT security policy. And whenever there's any challenges, to ensure that there's the right uptime and everything is running smoothly. So that is, also, there's also quite a few other projects that we've helped around the region, around the globe actually. Jamaica, we helped build an EMR and a data pipeline, which is more or less like a space surveillance system as well. And there's been quite a lot of learnings between Kenya's CBS and Jamaica's CBS. We also helped build an electronic system that is helping to eradicate malaria in Namibia. This was built on a platform called ODK. So basically mapping where the cases are with a very short turnaround time, 24 hours, and trying to get prevention materials to those areas in time. Then also measuring tuberculosis prevalence within the Southern and African region. This was South Africa and Eswatini. This was a very interesting use case. We had trucks moving out, but each truck had an information system supporting tablets. They'd go out in rural areas and try to test samples for tuberculosis and do also imaging as well. I think that was the next slide. That was the last slide for me. Yeah.
Yes.
So over to you, Koki.
Thank you, David, very much for that. And so just picking up from there, we just want to share a bit about how Global Programs supports the Informatics Hub and all the good work that you have had David mention. So at really project level, we are able to support the recruitment and the management of project staff. That's both technical staff and any operations staff that may be needed related to the work. We provide administrative and logistical support for all the activities. We control the expenditure and the disbursement of resources in accordance with established procedures and in compliance with sponsor requirements, because we have to make sure that we do not have any disallowed costs and so on. So compliance is very key, as well as ensuring we are mitigating any risk, because we also do not want to lose any resources. We procure goods, works, and services and support asset tagging and inventory management as per organizational policy and sponsor requirements. And we also provide IT support for the security of data, network access, backup systems, and application support. And a lot of these systems are really in line with UCSF systems and policies. And so we are able to make sure that we really do provide high quality support for the hub and any other project. And at organizational level, that's at a higher level, we are able to support relationship management and engagement with government, donors, and partners. This is actually one of the areas that I really do focus a lot on. I'm able to build on the relationships that I have. I did my undergraduate and postgraduate training here in Kenya at the University of Nairobi, which is the oldest medical school in this country. And so a lot of the people who we find in the Ministry of Health are people that, I've had a chance to interact with. Either they taught me or were colleagues, and, we still meet. So I'm able to leverage this to ensure that I support the projects. And so this is one of the ways you could also benefit, that if you're interested in exploring various opportunities with new partners, with the government, we are able to provide that support because we are here on the ground. And I think at this point, I should also mention that the current Minister of Health in the government of Kenya was actually our colleague at Global Programs. We were working together. And so in terms of just having goodwill for a lot of the things that we want to do, it is there. So that's something we are really proud of. Then finally, we also ensure compliance to government, donor, and organizational requirements. So that is very key. And we ensure all through, from beginning to end, we are able to track compliance and ensure that we do not have any gaps. So let's talk a bit about Kenya. So just a few key statistics. We have a population of 53 million people with a growth rate of 1.9%. Our life expectancy is 61 years. And when you look at our GDP, it's just slightly over $2,000. Health expenditure is 4.29%. And you can see we actually have a very heavy out-of-pocket expenditure, which is 24.09. This just gives a map of Kenya. We are in East Africa, neighboring, Somalia, Ethiopia, Sudan, South Sudan, Uganda, and Tanzania. So when you look at Kenya's mortality burden, just trying to look at, what causes the most deaths in Kenya. And this is looking over a period of 10 years. When you look at 2009 and 2019, just trying to look at the percentage changes that are there, we can see that HIV/AIDS is still number one. That was as at 2019. We also have, the other communicable diseases, diarrheal diseases, lower respiratory tract infections. They are still among the top causes of mortality. But then you start to see things like stroke, ischemic heart disease, cirrhosis, diabetes, slowly creeping up to cause the most deaths. And so in summary, if we were to look at really where is the burden in Kenya's deaths, you're going to still have communicable diseases and of course maternal and your newborn and nutritional diseases, but coming in closer, non-communicable diseases and then injuries. So looking at risk factors, what risk factors do we have? So we can see, again, when you compare 10 years between 2009 and 2019, we have malnutrition. So nutrition is a significant risk factor and a challenge that we still face in this country. And then, of course, you have things around unsafe sex. We have water and sanitation related challenges, air pollution. You can see high blood pressure is coming up there, alcohol use, high body mass index, high blood sugar, dietary risks. So again, you start to see metabolic risks, which are really related to non-communicable diseases, become something significant that needs to be considered. For a long time, the focus has been on communicable diseases, but even when you go and look at the statistics in the health facilities, when you see where's most of the morbidity and mortality coming from, you start to see non-communicable diseases are actually significant. And the government is now, trying to put more emphasis on it and see what more can we do to be able to control the rapid increase. And then environmental, occupational risks, as well as behavioral risks. Looking at health research, this was just between 1995 to 2015, just looking and seeing what were our outputs like as a country. The first thing to note is we're not doing very well in terms of research outputs. They're quite low. And even when you see, where are most of them around, where the research areas, where the focus is, you see, okay, there's quite a bit on health systems and infectious and parasitic diseases. But when you start looking at vaccines and medicine, looking at health technology, chronic diseases and conditions, environmental health, social, psychological determinants of health, emergencies, you start to see there's not much. And that also gives you an idea of some of the areas as a country where there's interest to strengthen our research capacity. So this slide here just gives a snapshot of our national research priorities. We have like 5 key areas. There's manufacturing, there's food and nutrition, there's universal health coverage, there's housing and research capacity, which is like a cross-cutting theme, because through research, you're able then to really come up with things that will affect these other 4 areas. So specifically going to universal health coverage, the priorities that the country has set is to start looking around novel healthcare delivery and public health systems, which are supported by modern technology, because we know there's a lot that's happening with ICT, nanotechnology. So the question is, can we start to do some of these things in Kenya? Then promotion of healthier lifestyles and addressing non-communicable diseases, including mental health. Of course, mental health has had a lot of stigma around it, but again, we are beginning to recognize that a lot needs to be done. And so this is one of the areas that we're not just focusing on the curative side of medicine, we're looking at the preventive and the promotive side. They also want to look at new technologies to enhance disease surveillance, prevention, diagnosis, and treatment. And so some of the work that's happening through the informatics hub is able to support some of these things. Disease prevention, focusing on infectious and non-infectious diseases, pharmaceuticals, vaccine development, alternative medicine and emergencies. Also just looking at early diagnosis and treatment of diseases, because a lot of times you find people will not get diagnosed early, so you end up dealing with a lot of complications, and that's a heavy burden on the health system. So you have to aim for early diagnosis. So a lot of it, just awareness, health education is able to get people earlier in the disease causation pathway, rather than then coming to see them all when they're in the health facility and sick and, with all sorts of complications. And then we have environmental health, focusing on water and sanitation, pollution control, occupational health and safety, and of course, climate change, the effect of climate change on health. It's also a big thing. So these are some of the things. So areas around this are things where you'll find the country, the research institutions in the country, academic partners are interested, the Ministry of Health are interested in anything that is around this area. So a bit about the Kenya Medical Research Institute, that is KEMRI. And what KEMRI does is to provide leadership in health research and development. It helps shape the national health research agenda. It articulates evidence-based policy options, monitoring and assessing health trends, and also deals with transboundary health trends and health threats and disease outbreaks. And KEMRI has been a key partner of UCSF. We are doing a lot of projects with KEMRI. And so I thought it would be nice to just summarize some of KEMRI's research priorities, because it's still area to do. There's still the opportunity and the space to do a lot more with KEMRI. So they are keen on health system strengthening, again, universal health coverage, looking at precision medicine models, looking at disease surveillance, emergency and disaster preparedness. A second thing they're interested in generally is public health and prevention. So looking at human food security and nutrition, environmental and occupational health. Then there are technical areas that they're interested in, immunology, proteomics, genomics, and I think mental health and substance abuse, and also metagenomics, all those technical areas, they are very interested in that. And then innovation, which is around drug discovery and pharmacovigilance, stem cell research, nanotechnology, natural products. So these are some things that we know UCSF is really way ahead in, and so there are opportunities to be able to partner with KEMRI and do some of this research here locally in Kenya. So this slide really just lists some of the academic partners that are involved in health research and education. University of Nairobi, as mentioned, is the oldest university that has been providing medical training in this country. It's almost 60 years old. All the others are really 30 years old and below, and we have some that, just started offering medical training not more than, 5 or so years ago. So all these are different stages, and there are opportunities. They're all interested in partnering with universities, in the US. They're interested in building capacity, being taught in, learning and mentorship. So these are potential, and this really is just a list. There are so many others, but I thought just to highlight these as some of the partners who I have engaged directly and are interested in various research opportunities. So the next slide, I just picked 2 universities. So I'll start with the University of Nairobi, which is the oldest university offering medical training, and then I'll also showcase one of the newer universities. So for the University of Nairobi, they're interested in zoonotic diseases, they're interested in machine learning for disease surveillance, cancer, and in cancer really looking at both clinical capacity strengthening as well as cancer surveillance. We do have a national cancer registry, but it's very basic. And there've actually been some discussions with some of the faculty at UCSF about how, maybe as a country, we can get to learn more about how cancer registries are done and strengthened. So there's a great opportunity for cancer surveillance. And then grant writing training for students and early career researchers, tools and training on grants management and award administration, because it's one thing to write a grant, but it's another one to actually implement it and implement it well, manage well, make sure that everything runs well. So they have acknowledged that there's room for training and they would like that. And then of course, opportunities for faculty and student training, fellowships and exchanges. And one of the things that we are currently working on is a PI fellowship program, because one of the challenges that the University of Nairobi has is they actually have a shortage of PIs. They have great ideas, but they don't have principal investigators. They don't have people whose capacity has been built in the area of research. So the thinking with the university leadership is Can we train and mentor young researchers at UON through training arrangements with UCSF based on, shared research interests and expertise, and thereby foster a mutually beneficial mentor-mentee relationship? So through this fellowship, there'll be training and capacity building in research methodologies, grant writing, project management, leadership skills, responsible research, really want to facilitate research collaboration and exchange. And the university is absolutely thrilled with this idea. We are still working on it with some few faculty at UCSF, and it is our hope that we'll have more of you come on board and really want to be part of this. As you can see on this other column, their areas of interest are diverse. Just looking at disease epidemiology, emerging and re-emerging infectious diseases, neglected tropical diseases, looking at, One Health, climate change and health. So there are so many areas, and the plan for this is that it's a mutually beneficial relationship. So the areas that, UCSF researchers are interested in, and the areas that, University of Nairobi researchers are interested in, then we'll be able to match them, and, it becomes something that does help the research world. Then I picked Masinde Muliro. This is a very young university. They just started offering medical training the other day. I think they're going to have their first class graduate in about 2 years or so. And so they are also thinking of, we want to work in the area of mental health and substance abuse. We want to do research on community health, look at infectious diseases. They also want tools and training on grants management and award administration. And then they also want opportunities for visiting teaching faculty, whether it's just going to be virtual classes or, once in a while you have people come over, they would be happy to have faculty from UCSF, or will teach at the medical school. They have a medical school and a school of public health, and they have both undergraduate and postgraduate. So this again is an excellent opportunity to be able to partner with an institution that is looking to grow, wanting to strengthen, and they have very eager researchers who'd like to partner with UCSF and do some research that is mutually beneficial. And so in general, when you just summarize, the academic partners, what they're really interested in is these are the top interests, communicable diseases, climate change and food security, non-communicable diseases, neglected tropical diseases. They still have quite a big burden in this country, mining and health. When you look at gender and sexual and gender-based violence, reproductive health, dermatology, and so many others. So these are some of the things that come up, and they're always do you have faculty interested? Is there an opportunity to work with someone? And so I hope by sharing this, it'll start to generate interest, and we'll be able to link you up with, the different partners and the different researchers who are interested, and together you can be able to explore and see what projects you can go for together. And so I think this is my last slide. Yes, so this is our contact information. So you can reach out to me, as well as to also the International Research Support Operations team led by Joe, with the contacts there. Thank you very much. Yes.
Thank you so much, Koki. Perfect timing. We want to use the rest of the 20 minutes that we have to answer any questions you might have for Koki about potential opportunities and how to engage further in Kenya. I also want to thank David for his presentation. He's also available to answer any questions you might have. And we'll also invite Jane Drake, who is the Director of Global Operations in the IRSO office, who can answer any questions you might have about central administration of global programs at UCSF or any of the other offices in case an interest came up there. So I will read the questions out for those who might be watching this later on video, and we'll do our best to answer your questions. So please feel free to add to what's already been included in the Q&A box. Koki, the first question, this is from Linda Shaba. She's from Kenya, and she's currently at UCSF as a postdoc. She has a lot of interest in mentorship and would like to know if you have any programs that mentor upcoming scientists within the country or internship opportunities for graduate students.
Thank you, Joe. I think what I mentioned about the upcoming PI fellowship program probably fits there, because that's a program that we want to start jointly with the University of Nairobi. And so it's still in the idea creation stage, but I believe it's something that has a lot of potential. So that's something Linda can tap into, and we see how she can get on board and get maybe other opportunities with other universities.
The next question is from Lauren Sushman. She wants to know, is there a listserv she can join to learn more about how the PI fellowship program develops, for example, or other opportunities in Kenya?
Oh, great, that's a great idea. We are still brainstorming on how to get started. So definitely, I think we'll put a listserv there so that we can figure out how to get people involved. We are still just, selling the idea and trying to get faculty interested. So because we do need a few people to spearhead this. So I think as it develops, we'll be able to figure out how to share that so that it's widely available. But our desire is that it's open and involves as many people as possible, with as many thematic areas covered as possible.
Another question, how does global programs interface with partners like KEMRI? And maybe you could talk about, along with UCSF, like how do global programs UCSF both interact with our local partners?
Okay, so as mentioned, we have different categories of local partners. So there are those who UCSF will subgrant directly, and we only offer certain aspects of support. So like KEMRI, UCSF will give them a subgrant, and as global programs, we support with the administrative part of the project. We'll support procurement and logistics and so on. For other projects, we are able to support by hiring some technical staff, depending again on the nature of the program. So it really depends on what the local partner needs, and all this is done with UCSF. So dependent on the needs of the local partner, then global programs comes in to support technically and operationally, or maybe just operationally. But at the end of the day, we are here to make sure that what UCSF's, the activities that are being funded through UCSF are able to run well, they are compliant, that we ensure that donor regulations are followed, that we're also following government regulations, so that there are no issues that come up. So I believe that sort of covers what we do. So it's very partner specific, depending on the needs. Some partners need more mentorship, more support. We're able to give that. Others are stronger partners. So we are just maybe just offered like technical support and so on. So it depends.
This is from Anthony Muiru. He thanks you for your presentation, especially joining us for a late hour, which I think we can all agree that we appreciate your accommodation. His question is, does global programs have a strategic plan for capacity building to improve equity in terms of number of local investigators, as well as making sure research projects align with national research priorities? You mentioned the University of Nairobi PI fellowship program, but wasn't sure if this was a global programs initiative as well.
Yes, so actually this is a UCSF and University of Nairobi initiative that is still being developed. And this, we felt that having something like this is actually what is going to improve capacity, because as I mentioned, there's a shortage of PIs. So you'll find we have so many ideas, we want to work with the local partners, but when you come, you find they don't have the capacity, they've not been trained, they've not had any mentorship. And that's why with the UCSF and Global Programs team, we started thinking, how can we address this? And then the PI fellowship idea came up. It's still very new, it's been cooked, but at the end of the day, we believe that this is what is going to make a difference. And it's obviously now going to be aligned with the research priorities, because as we said, we will be able to look at what the universities want and what UCSF researchers want, and look for the areas of alignment and mutual interest. So it is, I think this really is the best way forward in terms of building research capacity in this country. And it's something that is scalable. If it works well, we can bring in more universities into the whole program.
I'm going to combine two questions here. One is, how is global programs funded? And how do we make use of the resources that global programs offer? Do these need to be written into the grants? And Jane might also be able to comment on this as well.
Yes, so in terms of being funded, we are funded through UCSF, because as we said, we are the implementing arm of UCSF in country. And so there's a cost that is apportioned to the grant for our support. And so it has to be written in. But I think now Jane can also add a bit about that.
Yes, thank you for that question. The most effective way to include global programs in a grant is to contact the global programs operations team in the IRSO office. And that means you can contact me via email. We can set up a meeting and we can discuss what your needs are and share exactly how global programs can support that. The benefit of global programs is that you don't need to have a separate sub-award agreement. So if it's budgeted into your grant proposal when you get funded, and a lot of them get funded, then we can immediately start work without having, we can get it set up within a few days and you can start work. So please contact us. Also, the IRSO website has a lot of information, general information about global programs and how it works, and I would recommend checking that out as well.
Yeah, that was a question from Paul Agongo from the Division of Experimental Medicine regarding, is there a website or resource where we can learn more about the interests and the studies that Koki described?
Yes, there's a UCSF website that has links to all these studies. Maybe Jane, you can give the exact website? We can share the link.
Yeah, and there's also a quarterly newsletter for global programs where the information on some of these studies as they evolve is shared, and we can include participants from this webinar in that future listserv. Koki, another question. As an early career researcher, what specific projects do you imagine can be done for mental health research, like needs assessments or qualitative explorations, and non-communicable diseases?
Well, I think most of it, of course, we'll be looking at just trying to maybe quantify the burden of the mental health issues and non-communicable diseases. You'd want to look at maybe gaps in the provision of services, and maybe, have interventions that you want to explore whether they'll make a difference and improve service delivery. So I think for me, research that is trying to solve the problem and address the burden is what is going to be more effective, because we do know that the challenge is there. Anything that can help address even things around stigma, especially for mental health, that is going to be helpful, because then it helps, guide policy, helps, set in place guidance for those who are working in the health facilities and the government on basically how to run these programs. So I think if you look around that, trying to alleviate the burden, understand it better, and come up with a way to deal with it would be good.
Great. And a little bit more about the PI mentorship program from the University of Nairobi. Is there a plan on how this will be funded?
Yeah, we are still thinking. We are trying to look and figure out how do we get funded for this. We're trying to explore, is any donor going to be interested to fund something like that? So this is actually like just a month's worth of thinking. It's still very new. So we will also appreciate if anyone has an idea of how something like this could be funded. It would be good, but we're exploring various options, because it is a really good thing that we want to get up and running.
Great. I think there was one more question that disappeared on me, but it was basically, from here going forward, how best to engage you and to develop a partnership? What would be your role in developing a new partnership or a proposal? How can UCSF stakeholders utilize you and your team to move things forward?
Okay, so I would look at it in that I'm here on the ground. I have met with these different universities. They've expressed their areas of interest. And so if anyone is interested in pursuing anything that I've mentioned today, please reach out directly to me and I'll put you in touch with the relevant university, and together we'll be able to start discussions about what can we do. So I'll be there to initiate the contact and then also support you and just make sure that we're able to develop something out of that relationship. Again, for all the partners that we work with, we have institutional affiliation agreements. So some universities, we are yet to develop them. So part of my support will be to make sure that institutionally we are able to have that agreement in place so that then you can be able to develop your project. So my work is to really work hand in hand with you and make sure that you get started and that there's a structure in place to support. And again, if you want to know more about, what the government is interested, I'm able to support that. So you just need to let me know what you want. And with my team, we'll be able to figure out how to get you connected, how to support. And yeah, I believe that is the first step.
Great. We have one more question. I think that's a good one to wrap up with. How does global programs support localization by enhancing capacity of local organizations to partner with UCSF? What kind of approach do you take for strengthening the capacity of our local partners?
Yes, so part of it is, again, as I said, the partners are at different levels. There are those who really do not need much capacity support, but the ones who do, we are able to work together. We've had occasions where we've had some of our partners say, can they come to our offices and just get to learn more about how we do things? We are able to discuss, because with all the different projects, we have leadership meetings. And so I participate in the review meetings with the various leadership of the different partners. And so we are able to look at some of the challenges. And if there are structural challenges, if there are challenges around the policies and structure in place, we're able to then initiate support. It could be directly from us or it could be from UCSF, but it's done jointly and based on the needs as they emerge. And so the opportunity to review quarterly and just keep touching base, you're able then to identify that this partner has a particular gap in this area, and then we bring on board the support that is needed.
Okay, thank you. I want to make sure that we take advantage of David's time because that was an excellent presentation from him as well. David, maybe just for all the listeners, what do you see as the future of our informatics work in sub-Saharan Africa? Where are we headed?
Thanks, Joe. So yeah, we have quite a lot of interesting work. The very new one that's really coming on the block is machine learning. So we've already had that implementation first with Kenya, as always. And that's really cool because it means we are really starting to tap into the future, looking ahead rather than looking at the now, right? So for example, in that particular implementation that you saw, just predicting results and hope, and maybe if these are clients that you think are going to be in trouble, then you can always just follow them closely because you know their status in the future is not going to be a good one. So that's one. Two is we have quite a lot of when it comes to technology that is coming out there. We have quite a lot of projects that will come up and will need to be using the digitization. So even if it's for your fellowship programs and you think you need to do some data collection, and we're already seeing this quite a lot. So what we do as the informatics people, we will support some of those, even if it's just as simple as data collection, right? So you may be having a study and you want to go out and collect information, and that might involve thousands of records, right? So you're not going to collect it on paper. We can just give you some simple support on how to digitize that. And then you can go out and maybe collect information on tablets. We're already doing it in a few countries already. So we can actually offer support in this area as well.
Great, thank you. Well, I know we're going to continue to hear from you about how you guys progress in your projects, both from the Institute for Global Health Sciences Communications Department, but we'll hopefully also hear through the Global Programs newsletter as well. So as we wrap up this session, I just want to remind you, you will receive a recording and a copy of this presentation, as well as clarification on Koki's contact information if you want to follow up on any specific projects in Kenya, or Jane Drake's contact information if you want to follow up about global programs generally. So that'll be coming out next week. I want to thank our presenters. I want to thank Winona Ward for providing the introduction, Koki Kinagwi and David Magume for providing the presentation, Sherry Songer and Robert Mansfield for supporting the hosting of this webinar. We look forward to doing this again in the future with some other countries, but Kenya being one of our larger portfolio countries as a university and our largest global programs office, I think this was a good place to start, but hopefully we can continue this engagement with UCSF stakeholders. We appreciate your time today and look forward to connecting again in the future. Thank you all. Have a great day.